Okay. So just know the different types of history, because you might be asked that, you know, if I'm, you know, an illicit drug user, what is that? That's part of my social history. All right. How about hard skills and soft skills? I don't know if y'all saw that before or if that was new to you, but does everybody understand what those are?
Yes, ma'am.
If I can take a really good blood pressure, that's what kind of skill?
Hard.
Right. But if I'm an ass while I'm doing it and I'm not very nice, then I don't have very good what? Soft skills.
No.
So that's really your demeanor, your personality, the way you know, you're sensitive to different cultures, the way you come across. That's more of a soft skill. Are you accepting of other people? You know, your hard skills are exactly the way it sounds. Blood pressure, temperature, the way you know how to do your job. I think number 6 was something about like what makes a good EKG tech. I don't have the questions pulled up. Somebody tell me what the question 6 is.
3 ways that EKG technicians show initiative at the workplace.
And again, that's not a right or wrong because, well, it is, but I mean, everybody's answers are going to be different, right? So does anybody have a question about that? I wouldn't imagine. No.
Mm-mm.
Okay. There's a lot of questions about being culturally sensitive. A lot about liability and legal. Just know that the question, I mean, they're pretty common sense. If someone wants to maintain like if you have a female patient and their religion is that they can't be alone in the room and you're a male EKG tech, a lot of times they'll ask the family to step out. But being culturally sensitive, you would allow someone else to stay in the room. That, I mean, does everybody understand like what cultural sensitivity is? Any questions about that? Because I didn't see that.
No.
Okay. Requirements for certification. Is that what the question for 8 is?
Yes.
You're always going to check with your employer first. So you're going to check to see what they require, but you'll always fall under your certification. I think it comes from the HSA, right? So you're always going to make sure you're with your employer and with whatever certification or license that you have, that's who's going to govern what makes you certified. So again, the answers will be your employer and the certifying body who gave you your certification or license. I guess number 9 asks you if you have to have what kind of CPR you have to have. Is that right? What's number 9?
Mm-hmm.
And does everybody have that already?
Yes, it's AHA, basic life support.
And you have to have that before you can do clinicals, right?
Right. Yes, ma'am.
Okay, so all y'all have that already. Civil versus, oh no, chain of command. That's different than scope of practice. So chain of command tells you what? Who gives you your assignments and who you talk to about concerns or needs. So just know that with chain of command, like that's how you approach like problems in your facility or where you get your assignment. Everybody understand that part? No questions about chain of command or why we even have to address that? Okay. Civil versus criminal. That's a lot of like HIPAA and a lot of like legal issues in the hospital. You'll hear civil or criminal. Civil means there's not like jail time or, you know, penalties like that. It's mostly monetary fines. You may have your license taken away. And then criminal, you could have jail time or monetary fines. Is everybody good with those two?
Mm-hmm.
Number 12, was that, what was that? What was the answer or question number 12?
What did high tech act?
The High Tech Act. That was That's exactly how basic that answer is, but that is what happened. That is when everything went from paper to electronics, and that was the big push, where we now do a lot of everything by electronics. So just remember that the HITECH Act did what? We went to tech. We went from paper to electronic records. And then number 13, what was that question to that?
The function of the Joint Commission.
JACO. And what do? They evaluate and accredit healthcare facilities, and they use that data for ongoing improvement. So they're not like DHEC who comes in and can like take away your certification, but JACO is the one who gives you your facility, like their accreditation, and they use that information. So if you're not an accredited hospital or an accredited facility, then you don't get a lot of funding, and nobody wants to use you. So JACO is a big deal in that. That's what they do. The Joint Commission for Accreditation. So just remember, if you see that, what's their main role is to accredit healthcare facilities. Because I'm sure you will encounter them at some point in your career. Number 2 is not due until Tuesday, but we are going to test. So if y'all haven't done it, if you want to just jot down some of these, and if you have, we'll just go over it, because these are pretty, like, you'll see these again. Let me pull up my question list here. Okay. So somebody tell me what the difference is in objective and subjective information.
Objective info is signs and subjective is symptoms.
So give me an example.
Objective would be a heart rate, and subjective would be like nausea, chills.
Right. Anybody else have a good example of those? You will see that again. Nobody has another example of an objective or subjective? Y'all got it. Y'all, I'm gonna have to pull teeth. I know it. This is, oops. Okay. Everybody understands that one?
Yes,
All right,
ma'am.
we're going on then.
Mm-hmm.
Okay. Number 2, OSHA. What does OSHA do? Somebody tell me what OSHA does for you. Somebody, anybody, speak up.
OSHA sets standards to protect workers and provides safety education, inspects work sites, and sets fines for safety violations.
Right. Y'all know if we were in class, we would have like class participation points. So just remember that, because I got to pull teeth. I know this is just crappy information. We got to get through it. And just if you have questions, let me know. Because OSHA, what are they doing? They're protecting the worker. They provide education. They inspect. When you have an on-site like accident, they're going to come and do the inspection. They are the ones that provide you as the worker with protection. The CDC, or the Centers for Disease Control, which right now everybody should know what that is, they do all the research. They promote public health. They investigate disease outbreaks, and they make recommendations. Right now they're working overtime. Anybody have any input about the CDC? What I can tell you, number 3 is what? What's question? What's PPE?
Yes, ma'am.
And what is PPE? Does everybody know what that stands for?
Yes. Personal protection equipment.
Right. And it consists of what? Gloves?
Gloves,
Gown,
masks,
gown.
goggles.
Yeah. all of your precautions. Know these backwards and forwards. I'm sure right now everybody's worrying about precautions, but everybody know the difference between airborne, droplet, and contact.
Yes. Yes.
Airborne travels through air, like TB, measles, chickenpox, droplet precautions, flu, diphtheria, rubella, all of those. And then contact. We all know contact precautions. Do you know, like MRSA, C. diff, do you know the proper PPE for each of those? That's what you need to start thinking about. You're always going to wash your hands. If it were me in this day and age, I would always put on gloves. Airborne is the virus, bacteria can be traveled through the air. If they cough, if there's, you space and time. So what are you going to wear on your face for airborne?
Shield.
What kind of mask for airborne?
Shield kind of thing.
Like the N95, right? So that I would always wear a mask with all of these, but the airborne, the one they talk about, the N95, is for airborne because it just travels in the air, it floats around. You want to make sure you're not breathing it in. Droplet precautions, you're going to wear your gloves, your mask. Why? Because just like the flu, it can travel. So many droplets stay on the equipment, the machines. And then contact, you're going to wear what PPE? Would you necessarily have to wear a mask for contact precautions?
No.
No.
Right, because it's more like MRSA. Now, when you're doing EKG, you would be wearing gloves, and you would make sure that you would use disposable equipment if you had it, like your EKG leads and your they make disposable for MRSA patients. If not, you would definitely clean it with the hospital cleaner to make sure you're killing all of that. So just try to think about what each is and what makes it a droplet, what makes it contact, airborne, and know the difference. Is everybody good with those?
Yes.
And
Yes.
then does 5 ask about PPE? Where should you put it?
Yes, ma'am.
In the trash. And usually it's going to be, if they're contact, you're going to be like, the trash will be in the room, it's going to designate where to put that. Should never be reused. That's a joke. Right now, that's the big push because they are reusing it and it's not good. First thing you're going to do when you walk in the room is what? Identify yourself. You're going to identify the
Yes.
and then what? You're going to identify the patient by 2 identifiers: name,
Date of birth and name.
and what else? What else can you use?
Date of birth.
What else?
The
Medical
bracelet.
record number. Their bracelet would have all that on it. Because what if the person can't talk? You're going to compare it. Medical record number, because you should have an order, right? If you start thinking like, why would I need to? I have an order, so it's going to have their medical record number, their name. You want to make sure. You might go into a person's room who has dementia, and they can't tell you their name, and maybe they went in the wrong room. So you always want to make sure like what you have as far as your order matches what they will ask that in some way or another. Just know that, and know that your 2 identifiers can be other than like name, date of birth. You have several to choose from. Those are the main 2, of course. Anybody have questions about that? Oral thermometers. Did y'all read that part about oral thermometers?
Yes.
10 to 20 minutes. Under the tongue, but like if the person just had fluids, you're going to have to wait, correct? At least 10 to 20 minutes. Chewing gum, I have no idea why it would affect it, but we're going to go with what they said. Everybody understand the difference between apical, radial, and brachial pulse. Where's your apical pulse?
On the left side on the chest, on the
Mhm.
nipple.
Mm-hmm. So the apical is right, you know, at the bottom of your chest. That's your apical. Just know that, you know, if you have 3 to pick from, one's on the chest, that's going to be it. Radial is where?
On the
Radial, it's on the wrist.
It is.
Inside the wrist, yeah.
And
then
brachial is on the arm.
right. And brachial is one you'll do with a lot of like little kids or babies because that one's easy to feel. When you're doing a blood pressure, each cuff has its own size. You always want to make sure you have the correct size of cuff, because if it's too small, you may get a higher reading. If it's too big, you might get lower. So you always want to measure the cuff appropriate for your patient. Everybody know what hypo versus hypertension is?
Yes.
Yes.
Hypo is
Below.
low.
And then hyper is above.
So you can get hypotension. If you think about hypotension, just think, what are the things that could cause me to have low blood pressure? Most of the time, it's going to have something to do with volume, blood volume, bleeding. Person's bleeding, they've been vomiting, they've had diarrhea. Their volume isn't keeping their blood pressure up. So if you have a patient who has low blood pressure, what is one thing you're going to worry about when you're doing their EKG?
Readings.
Also, are you going to let them just stand up?
No.
No.
What's going to happen if they do?
They'll get dizzy.
They might
Pass
pass
out.
out.
Right. So that's what you want to worry about with hypotension, is that you get lightheaded, you stand up, all your blood goes down. So those are things you're going to worry about. It may be harder to pick up an EKG reading too. How about with hypertension? Those are more of the chronic things, but what are some things that can make you hypertensive? Fear, maybe they're anxious about the test. So what are some things you can do?
Smoking.
Being stressed out.
Yes, all of the above. What can you do as the
Help
EKG
them calm
tech?
down.
Right, just help them to calm down. Because also, we're going to get into that, but with your EKGs, you're going to see a lot of artifact, and artifact will be caused by movement or other things, but if they're stressed, they're nervous, you will see a lot of artifacts, so you're going to have to figure out how to fix that. So, what's the question, number 11?
Cold extremity, and darkness. Low blood pressure.
That's what number 11 is?
I think so.
The question, let me see.
Bad circulation.
I'm sorry?
Well, low blood pressure caused the cold extremity.
It must just be your pulse ox. Let me look. That's got to have something
Yeah,
to
it's
do with
about the pulse ox.
Yes.
Yes.
Yeah, it's about the pulse.
Why would you have a hard time getting a pulse or getting a pulse ox on your reading, on your, the pulse ox that they put on your finger? You might not get a good reading. Why? If you're cold.
Dark nail polish.
They're cold.
Right. Or if you have poor circulation.
Poor circulation.
Because when you put that on someone's finger, what are you actually measuring?
Their pulse.
What else?
Iron.
What's it called?
Iron.
A pulse oximeter?
Mm-hmm.
So think about that word. What's the other word that's like ox?
So checking the
Oxygen level.
oxygen.
Right. So what you're
Oxygen
doing
level.
is you're checking that blood
Their oxygen flow.
or the
Okay.
oxygen level. So if you put that on someone's finger and it's 96%, then you know that the oxygen is working. It's taking up 96% of the space on that red blood cell to move around the body. That's good. If it was 75, would that be good? No, because that means that the oxygen level is not good. So the pulse oximeter is actually measuring the blood or the oxygen in the bloodstream. So how much of that space on the red blood cells being taken up? That's what your 96% is. 90. Usually if it's above 95, that's, you know, decent. Below that, unless they're like chronic COPD, smoker, you're worried. If you and I had 90 or less, we'd, you know, start to have, you know, problems. So that's what you're measuring. And then that's why if you do somebody's pulse ox and it's not right, check to make sure that they're not cold or they don't have on dark nail polish. What is number 12? Does anybody have a question for number 12?
List 5
5
symptoms that
signs or
indicate the
symptoms.
patient is in pain.
Okay. So you're going to have a lot of
Crying.
different answers.
Frowning,
Right. They might be, their heart rate might
crying,
increase.
frowning,
Mm-hmm.
grunting, teeth,
What's going to happen to your respiratory rate?
attitude change, behavior change,
What's going to happen to your blood pressure?
Increased pulse.
yeah, increased pulse, respiration,
Mhm.
blood pressure, sweating,
Right.
tightening of jaw.
So those are like those aren't things you can't really assess, but I mean, except for like blood pressure and respiratory rate, but there's some like visible and physical things you can notice about pain. It's very hard to assess someone's pain when they're having all these symptoms, because you are going to be not forced, but you will come to a point where you'll have to document, and that's what you'll have to document. They couldn't tell you what their pain level was, but they were, breathing fast, eyes were squeezing shut, they were guarded. Everybody know what guarding is? Anybody not know what guarding is?
Mhm.
It's like if I have shoulder pain and you come near me and I move away, or that part of my body I guard. That's all that is. And that would be something you could document. So number 13, let's see what the question. What was number 13?
When assessing a patient's level of consciousness, why is it important to know the baseline for that patient?
And why is that? Everybody know what baseline is, because we're going to talk about that a lot.
So you know where they. So you know where they
Baseline is
started
the
from the beginning.
normalness.
If there was any change,
Right.
basically to see if there's any change from beginning to end.
If they're having cocktail hour, I'm coming to your house. Okay, right. So you want to know what their baseline is, because I need to know if that is a change. If they were confused when I walked in the door and they're still confused, I'm not too worried about that. But if they were fine when I walked in the door and now they're confused, that's a change in their baseline. So everybody knows what that means to have a change in your baseline. If my baseline blood pressure is 120 over 80 and now it's 190 over 100, that's a change in my baseline. But if my baseline is 190 over 100,
Yes,
not much of a
ma'am.
change. So you'll always want to make sure you know the patient's baseline. You will see that again. List situations which vital signs should be reported to the nurse. Give me some feedback on that.
If there's a change,
If patient has
A change in what?
if there's a big change in the
Their
blood
base-
pressure or
From their baseline, right?
pain level in the patient, then you report it. Yes, ma'am.
Or if it's above or below for the age of the patient, you're going to see that. That is a specific question I've seen over and over. If you're doing EKG on a child and their heart rate is a baby, say you're doing a 5-month-old, 130, are you going to stop the test and go report that?
Yes.
No. Why? Because we're going to get into that next. What's normal for that age group? That would be 100 to 150. So that's why it's good. You have to know what the norm is for that age group. Babies' heart rate is really high. If I come in there, my heart rate is 140, are you going to stop it and go report it? Yes, because that's not
The
normal.
chicks, they always lay far away from the light.
So
What's the
does everybody
check?
get that? Like why you need to know the vital signs for specific age groups?
Yes.
Yes, ma'am.
I don't think that was in chapter 2, or was it? Did y'all have a graph in chapter 2? Put that on it?
No, ma'am.
Yes, ma'am.
Oh, yes, we did. Yes, we did.
Yeah.
On page 29.
Yeah, and we'll go through that, but that is, yeah, you will need to know at least the general numbers, because you will see that. There's some slight variations depending on which documents you read, but if you know the basics, you'll be fine. So just know that a baby's heart rate is, if you've got 150, you're still okay. As you get older, what happens to your heart rate? It goes down. So everybody just will make sure you focus in on that, what you need to report. If I'm doing EKG and, their person is breathing 30 times a minute, are you going to stop and report that? Anybody?
Mm-hmm.
You are.
Ma'am.
Because what's normal breathing rate? 12 to 20 for an adult. So if they're breathing fast, that would indicate some things going on. So you need to know that.
Mm-hmm.
So those are the two. Y'all just make sure you review those questions and answers. Basically just go in the book so that you have to follow along in the book, and that's why it's good for you to do them. Did you guys look over the PowerPoint notes for chapters 1 and 2?
Yes, I did.
Yes, ma'am.
Everybody get them?
Yes.
Okay.
Yes.
I didn't at first, but then I did.
I'm going to give you all the, can everybody see my screen?
Yes.
Yes.
And it's the PowerPoint notes?
No.
You couldn't see my PowerPoint notes?
It's like,
No.
yeah, the notes we just went over, the answers we just went over.
Right, but I just put here, let's see. Let me give you this, hang on. Can y'all see that?
No.
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 Now we can.
Yes, ma'am.
PowerPoint? Okay, good.
Yeah.
So you see that number, chapter 1? Does everybody have some way to notate this as we go? Because I'm going to tell you what you have to know out of these PowerPoint notes. Because a lot of this is not stuff you can, I learn by doing and have to understand it, but a lot of this is just facts and numbers and stuff that you have to know. So I'm not going to sit here and read these to you because I know that you'd be bored out of your mind, but I'm going to let y'all know what you need to know out of here. Is everybody ready for that?
Yes, ma'am.
Did everybody take medical terminology prior to this class?
Yes, ma'am.
Yes.
Do y'all feel like you got a good grasp of that?
Yes.
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 Because I know last time there was some people who didn't feel like they got a good grasp, so it's like if you see cardio in a word, you know what that relates to, right?
Yes.
Heart.
The heart.
Yes.
Okay, so everybody knows what an EKG is. Know these
Yes.
for the test.
Yes.
No, who does the diagnosis? Do you?
The doctor.
Doctor.
The doctor.
Where are you going to get your diagnosis from? The doctor. An order should come from the doctor, and it should have a diagnosis on it. So just know these terms. Everybody got that? If I go too fast, somebody just let me know. Because this is unfortunately just,
Your phone ringing.
y'all are good? Know the difference in these different facilities. Does anybody have questions on any of those? Ambulatory versus outpatient versus acute care. Where will you do EKGs? At all of these facilities. Will you know your roles in these facilities? Everybody good with those?
Yes.
Y'all don't scream out loud. If you have, then I won't know. Because I don't want to assume everybody knows this stuff, but you have to tell me if you don't. Inpatient, that's where the person's admitted. So if you do an EKG as to an inpatient, you know that's why. Does everybody know what a myocardial infarction is? You're going to hear that a million times.
Heart attack.
Right.
Yeah.
But it's called a heart attack, but what is actually happening? It's key to know what's happening, because as we move along, those are the things that are going to make sense to you. So when you have a heart attack, somewhere in that blood flow, the blood flow is
There's
not
a
happening.
blockage.
There's a block. And what's not happening? If you cut that blood flow off, what's the blood flow carrying?
No,
Oxygen. So you're cutting off the oxygen to that part of the heart, because they're blood vessels that supply the heart. So if you cut those off, that's why you have like a heart attack. If you cut that off, then you cut off the oxygen and you cut off the blood flow. So that, and that part of the heart muscle dies. So you can't regenerate that. That's what happens in a heart attack. If you have a complete blockage of one of those vessels, then they go in and do like a bypass, a cabbage. That's what they call it. It's a coronary artery bypass, because they have to reroute so that the heart can still get blood flow. So just know that when you have an MI, a heart attack, what is happening?
You're losing oxygen to your heart. You have a
Right.
blockage.
Because the blood flow is blocked. Because the blood carries the oxygen. Okay, everybody good with that?
yes.
Yeah.
Everybody
Yes.
good with scope of practice?
Yes.
Yes, ma'am.
That's what you're
Yes.
allowed to do.
Right. It's your duties, what's expected of you, and what you're legally allowed to do. You will always be able to stand on, that's beyond my scope of practice, but you're never going to be able to stand on, well, he told me to do it, he's my supervisor, I knew it was beyond my scope of practice. Then it's all on you. So just know that's the difference. Okay, these are just examples of where EKGs are going to be conducted, all these different facilities. Just know that these are ambulatory care settings. Everybody good with that? Like rehab, physical therapy, inpatient, could be long-term, short-term, nursing home. Everybody good with how that would be different? What your day-to-day tasks would look like if you were in the hospital versus physical therapy?
Yes.
About the advantages and disadvantages of both. You know, it may depend on where you want to work. You know, you might not want to be stuck in a hospital and doing the same EKGs all the time. Cardiac rehab is cool. You can, you know, there's a lot of facilities. Just start thinking about that. Everybody know the difference in soft skills and hard skills.
Yes.
Yes.
Everybody understand what prejudice is.
Yes.
Yes.
So prejudice is your opinion of an entire group of people, right? Based on something. Their weight, their race, their religion, whatever. Just know that that's your opinion based on a whole group. Sometimes you get a little confused about prejudice, and you may see that in a question that doesn't even like say what it is. It'll just have that in there, and just know that that's my opinion about an entire group of people based on something. Green eyes, blue eyes. Empathy versus sympathy. Does everybody understand the difference in the two?
Mhm.
Yes.
So if I'm empathetic to you, then I understand your feelings. So I'm empathetic to the person who's had, 2 children by C-section because I can understand that and I have experienced that. I can be sympathetic to someone who has never had kids and is trying, because I can be sympathetic, but I don't understand that. So does everybody understand the two, empathetic versus sympathetic?
Yes.
Mhm.
Code of ethics, we went over that, but basically what is code of ethics?
Right or wrong.
Right. It's and everyone has their own set code of ethics, but each facility where you work will have theirs. You have your workplace ethics, business ethics, but you have your own personal set as well. So a lot of times they'll ask about code of ethics. Well, sometimes it's what's right or wrong in a particular setting. If you are hurting someone because you're trying to draw blood or give them medical treatment, then that's right.
Yes,
If I'm hurting
I got it.
out in the street because I feel like it, then that's wrong. So just know that code of ethics, you know what that is. Qualities of a great EKG tech. So just know those. I think it's pretty common sense. Flexibility, able to have integrity, problem solving, reliable, problem
Dependable.
ability, and like being a people person is definitely, you have to get pretty personal with someone when you're taking their shirt off and you are that close where you are applying, electrodes to them. So you have to kind of get over that fear or that, being reserved, because they are kind of feeding off how you're feeling. Problem solving, you're going to have that. That's huge because your machine may not work right. You may have artifacts. You may have a rhythm you can't figure out. So a lot of times that is definitely a necessary skill. Let's talk about positive nonverbal communication. Everybody gets that, right? We do
Yes, ma'am.
we do an exercise in class, verbal versus nonverbal, or like positive versus negative, and it's amazing how different you read people, like just based on the way you stand, the way you look. Do you have like that face that makes you look not nice all the time? Negative, there's a lot of times that people look negative and they're actually not. I cross my arms a lot. People think that's very like I'm being like excluding them or like keeping people out, but it's just that it's kind of awkward standing there sometimes with just your hands hanging down. So just know those. Everybody know these different certification versus license.
Mm-hmm.
Yes.
Certification is a credential that you're given, that you've met these standards, that you've passed your class, that you've passed the exam. A license is that you legally have to have this, you have to pass an exam, you have to complete these. It's different. A certification is more something you get from an organization. A license is more of a legal process that you have to go through. I think everybody understand those two? Boring, I know.
Mhm.
Yes, ma'am.
Clinical experience, everybody knows what that is.
Yes.
You got to have it. You're going to have it after this. What is the certification process? Y'all should know this already, right? Because they would have told you it's different from your license. The NHA, so it was NHA, they give you your certification. They have their own test. They're basically the same. All you have to know is what they require. They require you to pass this class. And they require you to do your clinical hours, and then you can take the exam. So you complete the class, you do your clinical, you pass it, and then you pay for your fee. And y'all will do just fine.
How many hours for the clinical?
It's not so much hours. You have to do like 25, I think it is. Which, if depending on where you go, you could do all those in one shift. So if you're working in the ER, you might could get those in one shift. If you're working, you know, in an outpatient facility, it may take you 2 or 3 shifts. But they will work with you on getting you set up, and I've never seen anybody have any problems getting their EKG. Let's see. Everybody knows what CPR is.
Yes.
Yes.
And when do you perform it?
If you don't have a
When
pulse,
someone stops breathing.
Cardiac arrest.
When your heart or your lungs stop working. Because when you're doing CPR and chest compressions, what are you doing?
Pumping the heart for them.
And right, so it continues to pump blood. That's what you want. Because why? The blood carries what?
Oxygen.
Oxygen.
So you want to keep the oxygen flowing. So when you're doing that's why a lot of times if you can't do breathing, you will just do compression only. Compression only CPR is better than nothing, and you're keeping the blood flow. So you're keeping that oxygen flowing because that's what's important. Everybody understand that part? Good.
Yes.
Yes.
So y'all will have to maintain that. You'll have to renew it, and your facility may require like their version of it too. Demonstrate proper communication. This is pretty common sense. I think everybody here can do that. Did everybody get the list of abbreviations? You should have had that in medical terminology. That should have been just a refresher. Did everybody get that?
No, I didn't get a list of abbreviations.
I sent out some handouts that were from like 1 and 2, and it had a list of abbreviations on them.
Yes, I did.
Yeah.
Did you send by email?
Yes.
I think so, yeah. I can send
I have to check.
just send
But
me
I
an
don't
email and tell
think
me.
I got.
I sent a lot of that. I have a lot of handouts just because in class, you know, you go over them, you write on, it looked like this. Y'all didn't get this?
It's still showing the slideshow.
You know, here, hold on. Where is it? Oh, here. Did everybody get that?
Yes.
No, I didn't get that.
So everybody, Kiki, or is that Charity? Who didn't get
It's
this?
Kiki. I didn't get that.
Okay, let me write that down. But everybody else got it?
Yes, ma'am.
Yes. Yes.
Yes.
Mario, you got it?
Yeah, I got it.
Okay. You're not going to be retested
Yeah.
on those, but you might see them again. So I would just make sure you kind of know, like I'm not going to give you a test with this on it. Like just know that if it says PRN, that you would know what that means, but you should have gotten that medical terminology. So, and then the rest of these, normal ranges, this is the sheet that I'm talking about. You have to know these. The normal ranges for adult, normal pulse, blood pressure. No
Yeah, I
decimal.
didn't get that. And I checked my email.
Okay, I'll resend it to you. Oh, know when to wash your hands.
Okay,
If they
thank you.
ask you, always just say, I'm gonna wash my hands, regardless. Doesn't matter. You're gonna wash your hands every time. After I wash my hands and I touch the sink, I'm gonna wash them again. So just know if you see that on the certification, what should you do? If it didn't ask you about washing your hands, wash your hands. That's the best guess. Honestly, if you have to guess, washing your hands is always gonna be right, especially now. Skin variation, know this chart. hot and dry, diaphoretic, cyanotic. What does that mean? If I'm diaphoretic, what does that mean?
Dehydrated.
Excessive sweating.
Sweaty. Diaphoresis is sweating. So if a person is sweating, they might feel cold and clammy, but they're diaphoretic. And why? They could be having fever. They could be having a heart attack. That's a classic sign. Cyanotic, what does that mean?
Blue
Color
skin.
blue.
Cyan, that C-Y-A-N, that is like a root word for the color blue. So if I'm cyanotic, my lips might be blue, around my lips might be blue, my fingernails might be blue. What is that telling you?
Decreased oxygen.
Decreased oxygen in my blood. Pale skin, pallor, that just means, you know, it is what that your nail beds could be pale, flushing. Just the reason you're going to know these terms is that when you're asked on a test and it says the person was cyanotic, you would need to know what to do. Like, so the question may just contain the word cyanotic, but if you didn't know what that meant, you wouldn't know how to answer the question. So I would just be familiar with these. Here, this is what I was talking to you guys about earlier. This is a good one to know. I'm gonna put a big X on this compared to adults, because if you look at your pediatric vital signs, very different. If you have a baby that you're doing EKG on and their heart rate is 150, are you gonna stop it and go tell someone?
No.
No.
Right. Why? Because that would be normal. You see how as they get older, it goes down. But just know this. Like, look what happens. Blood pressure goes up, of course, with age. But heart rate, look at the respiratory rate. So if you have a baby who's breathing 40 times a minute, is that normal? Yes. Because you could see that on a test. The baby comes in the ER, you're told to do an EKG, the baby, and do vital signs. The heart rate was 140. What are you going to do? Nothing. I'm going to keep doing my test. Like, so that's why you'll have to know these. So just mark this chart. Okay. So there is that. Let's see. Go back to where we were here. So where were we? Chapter 1? Yeah. I'm going to get through this quick. I know you guys are just bored to death listening to me talk. Would y'all rather do stuff like this way so you can ask questions? Because y'all are not, if you were in class, I would force you to actually interact, but there's no way for me to do that because I'm not standing in front of you. But are y'all better this way discussing it, or with some material, we won't be able to do that. But some, I can just tape the lectures. What's good for you guys?
Either way doesn't matter to me.
Yeah, me either. I'm okay with whatever you want to do.
Okay. I just want to be sure you guys are able to get what you need and have questions. I think this way kind of forces you into that class time, but I know that everybody can't do that all the time. So you have, I am recording this, hopefully it'll work out, but because there is one person who can't be here, but she was able to take the class because we could do this. So, but as we get into the material, it will be important to do this because you will have questions, I promise you. But this, stuff, I don't try to bore you. Okay, so let's go back here. Chain of command, know what a procedure is. Confidentiality, y'all know what HIPAA is, right? Everybody knows that. Everybody understand what HIPAA is?
Yes, ma'am.
Yeah, I know they beat that to death. Here's your chain of command chart that I was talking about. Basically, what you need to know is who I get my assignment from and who I go to for problems. That is your chain of command. That tells you. So just know chain of command. Policy and a procedure. So your company, your hospital, your facility will always have Policies and procedures. A policy is what? It's the course of action that we're going to take if something happens. And then a procedure is a step-by-step way of doing something. So every place you work should have a policy and a procedure manual. So policies are what we're going to do if we have a code black. A procedure is what we're going to do if we need to change someone's electrode. So there is always going to be that. Just know there is a difference in the two. We're not going to do it. Everybody know what protected health information is? You're going to see that about 1,000,000 times before your exam. Give me some protected health information examples. All of these.
Your telephone number,
Address.
Social security.
Mhm.
Health problems, your chart in general.
Yes. Any of that information you're going to find on someone's chart is protected health information. Email address. If it's in regards to your medical record, it's protected. So HIPAA, does everybody know what it stands for? Because you might not see the word
Yes.
HIPAA. You might see health insurance portability and accountability. What does that basically tell you? How to manage someone's health information. So it's basic. HIPAA is basically telling us what we can do with it, how we handle it. So does that make sense?
yes.
Yes.
I don't know where
Sorry.
this came from.
I did it, I'm sorry.
That's okay. I think it's shared. I don't. Yeah, you can share them or not. Well, let's see. There, I got it for you. So everybody good with that? No, I don't want that anymore. So what does HIPAA do? They can tell us what to do with your information, but they also are going to tell us what your penalties are for mishandling that. And that's a big, big deal for sure now. So just don't let anybody see or do anything. Somebody wants to see, somebody's in the room with you and you do an EKG and their partner or husband or wife comes over and wants to look at that, can they do that?
Only with their permission.
Right. So if they're out of it while you're doing that because you're in ICU and the person's not able to talk and the person wants to come over and look at that, can you let them see it?
No.
No,
No.
no,
Here's the thing. You can check the chart and see if the person,
unless they're power of attorney.
right, or gave them permission, but do you know that in that instant? No. So you're always better to err on the side of caution.
No.
So you can lose your license or your certification, you can be charged criminally. Just remember, if you get a question about that, if that ever comes up, can you show someone? If it does not tell you that they have power of attorney, your best answer is always no. Because sharing health information, even amongst family members, if the person is over 18, you have to have permission. More examples of protected health information. Everybody got these slides to go by, right? Like you have these to study by. You don't care about
Yes,
that.
ma'am.
Easier to coordinate. Let's see. Oh, this is the high-tech act that they were talking about. It's what transitioned us from paper to electronics. The government, even at that time, was giving benefits to facilities for changing over before they made it mandatory. It makes records more secure. It makes coordinating care. Just know that those are the advantages of this high-tech act. Like, why would they even think about doing that? It does make coordination of care easier. If I'm the cardiologist and you're the primary doctor, we can send our information back and forth to coordinate care. Joint Commission. You see how the Joint Commission is voluntary? But if I'm a facility and I don't want them to come into my building, they don't have to accredit me. Then I don't stand a chance. Like, they have to accredit facilities. So American Heart Association, they set the standard for treatment with BLS and ACLS. Do you know the difference in BLS and ACLS? Will you be certified in ACLS? No. BLS is CPR. ACLS, unless you're an ACLS provider, is advanced, where we give drugs, we use the,
For life support.
Right. You will get ACLS if you work on the code team. There's your chapter review. We went over those questions. Y'all got that? Okay. So there's chapter 1. Does everybody know from chapter 1 what you need to know? Right? Yes? You can ask questions too.
Yes.
This is an easy test because it's basically, there's not a lot you can interpret differently. So if you haven't turned in the homework from chapter 2, then you just do that before the exam. I would do it before you took the exam, but before 6 on Tuesday. Chapter 2, explain does everybody see this now, the chapter 2 PowerPoint?
Yes.
Mm-hmm.
Okay.
Yes.
So just know what vital signs are. Colette, do you see that, Mario? The chapter 2?
Yeah, I see it.
Okay. So just know these terms. We talked about them with the review questions. What the baseline is, that's very important. Vital signs, what they are. It's not always just temperature, pulse, respiration, blood pressure. It could also be what? Pain, pulse oximeter. So know that is a vital sign. Objective versus subjective. Does everybody understand that?
Yes.
Signs versus symptoms, basically.
Signs and symptoms.
So if it's objective, it's a sign. If it's subjective, it's a symptom, right? Know the difference in the two.
Right.
Yes.
Hint, hint. Okay. You just have to know these terms. Infection control, there's a lot. You're going to see that a lot. I bet they change a lot of stuff over just because of what's going on right now. So just make sure you know your precautions and these terms. You may see them in the form of a question that's not going to just ask you what's a pathogen. It's just going to have that in there. So just know what it is. Microorganism, pathogen. What's a pathogen? If I say pathogen, what are you thinking? Do we need to be cautious?
Disease.
Germ.
Yeah, a disease,
Yes.
infection, right. So pathogen is some kind of microorganism that will cause infection or diseases. Like a blood-borne pathogen, that's a microorganism in your blood that can cause that. What's one blood-borne pathogen we talk a lot about in facilities? Hepatitis. Hepatitis, very, blood-borne pathogen. If you think about blood-borne pathogens, it's hepatitis. So just think of anything that could be in your blood or anywhere that could cause infection. If you hear pathogen, you'll know. Infection prevention, every facility is going to have their own infection protocol, but that's just a set of practices that's going to prevent the spread of disease. Does everybody understand infection prevention? You usually have an infection control team in your facility. And then OSHA, what do they do? Who are they protecting?
Us.
The
Right.
worker.
That's right. Let's see. Centers for Disease Control, we talked about that. Y'all know who that is. Gosh, you're watching the news, you know who that is. Standard precautions. Does everybody know what standard precautions are?
Washing your hands.
You hear that a lot. Why do we use standard precautions?
You don't spread stuff.
Right. We want to prevent blood, body fluids, non-intact skin, mucous membranes. we treat them as though they were infectious. So the key is in standard precautions, basically you're going to use precautions for everything. You treat, you know, every surface and every place and everyone, not like they have a disease, but that you're trying to prevent any spread. How about transmission-based precautions?
Mm-hmm.
Do you know what transmission-based precautions are? Basically, it's exactly what it says. Precautions that you're going to take to prevent transmission. So if I have a person with MRSA and I'm an EKG tech and I think about transmission-based precautions, what am I doing? I am trying to prevent transmission from them to me and from them to me to someone else. So you have to think about all the precautions. Everybody got those?
Mm-hmm.
Yes, ma'am.
Hand hygiene. We know what that is. Wash your hands, wash, wash, wash. Soap and water, soap and water. Personal protective equipment. Everybody knows what that is. PPE and MRSA. Do we all know what MRSA is?
Mm-hmm.
Yes.
Methicillin resistant staph. It's a staph infection or staph bacteria that is now resistant to methicillin, which used to be the only medication that would kill it. So then it became resistant. So these bacteria have built up this resistance. So if you have a patient with MRSA, what kind of precaution are you taking?
Gloves, gown,
Which one? What's it called? Is it airborne?
Contact?
PPE.
PPE.
Contact. Is that Mario? Is it contact?
Yeah.
Yeah, it's contact precautions. Because if I have MRSA, that's a bacteria that's in my bloodstream, on my body. I'm not breathing that on you. That's not airborne. It's what kind of precautions are we going to use? Contact precautions. So yes, you're right. All your PPE, your gloves, your gown. Like, am I worried about airborne precautions with MRSA?
No.
I need
No.
to wear N95? No, I'm worried about contact. Because you'll see that a lot in the hospital, and they'll have the PPE hanging on the back of the door. You just know that they have MRSA. It's contact. People were really scared of it when it first came out, but I guarantee you, if you work in healthcare, half of us would have it. You swab everybody's nose, half of us would have it. It's just, it's a staph bacteria that lives everywhere. Let's see. Remember these points to infection control. Infections are spread when what pathogen from the infected person goes and multiplies into a new person or a new host. So know what that is. What are we trying to do with infection prevention? Stop the spread. So stop it along that
Stop
path.
infection.
Right. We're stopping that spread, that chain of command, that chain of, not command, the chain of infection. So we're stopping that. That's what we're doing. You have a duty as a healthcare worker to prevent your, spread, protect yourself and other people. So that's why you're going to use standard precautions with every patient, and then you're going to use special precautions with special patients. Does everybody get the difference in all of that?
Mm-hmm.
Mm-hmm.
Yes.
Standard precautions include this: washing your hands before and after, using PPE when you're going to contact body fluids or non-intact skin. You're going to treat all blood, body fluids, non-intact skin, mucous membranes as they're infected. So I can have a cut. I'm not worried about it. Should you be worried about it? Yes, because you don't know. So you have to treat me like I am infected. You're going to properly clean and disinfect all your equipment, instruments, every time. Frequent hand washing. So what's the best way to prevent spread of pathogens?
Hand
Frequent hand
washing.
washing. Yep. Does everyone know how to wash your hands correctly? We would demonstrate this, but you turn on the water, right? Don't let the water splash on your hands or on your clothes. Wet your hands and wrist. Apply soap. So does everybody know that you got to wet your hands first before you put the soap on?
Yes.
Yes.
All right. Keep your hands lower. Why are you doing that?
To keep
So the
it from
bacteria
flushing.
runs down, right? You want the bacteria from your hands that you've scrubbed off to run down into the sink, into the drain. So wash, wash, wash. Use a clean paper towel to dry, and then how do you turn the sink off?
With the paper towel.
Right. So we do that. When do you wash your hands as an EKG tech?
All the time.
Every time. Exactly. Every time. Most of these are a given, but just all the time. Again, putting on gloves, we would demonstrate that in the class. If anybody needs a demonstration, we can do that. You're not putting on sterile gloves, so it's not like you have to treat them sterile. But the main thing in gloves, on and off, what is the main thing you're worried about on and off?
You don't touch the side that you touch the patient with.
Right. So if I'm taking my gloves off, what am I trying not to do?
That's the inside of your glove.
Right. Treat your gloves like they are covered in like dirt, you know, or otherwise, because then you wouldn't want to touch your dirty glove with your clean hand. How are you getting it off? You're slipping your fingers underneath at your wrist and getting it off that way, turning them inside out. Everybody get that part? Just think about that. If you see that on a test, just think about how you would take them off. You see how this slide shows you put the fingers under the glove? Just think about they were covered in feces, how you would take them off. Like, you're not going to grab it with your hand. You always want to avoid touching dirty gloves. And if you do, what would you do?
Wash your hands.
Okay, let's see. So how do you put on PPE? Does everybody understand? If you don't know the exact procedure, just use your common sense. What are you going to do first? Wash your hands, right? So what are you going to do with the elastic strap? You don't want to touch the mask where it touches your face, right? So just always try to think in questions, what are they asking about? Infection control, how to maintain, you know, safe precautions. You're not going to touch yourself with your clean gloves and then think you're clean and go touch the patient, right? So just know that how to put on PPE if you have to go in and do a procedure on someone. Everybody got that?
Mm-hmm.
Do not wear the mask hanging from the bottom. How many times do you see people with their mask down like this and you're like, what is the point? Because now you just like, that's ridiculous, but that's a whole nother thing. Just go over the steps of putting on PPE and just know there is kind of a right way to do it, because you want to kind of go from the outside in, right? So just think about the way you put it on. You'll be fine. Standard precautions are used when?
All the time.
Every time.
Transmission-based precautions when they're ordered and in addition to standard precautions. Airborne precautions, does everybody understand airborne precautions? What's the main one we think about with airborne?
TB.
Tuberculosis, TB. What kind of mask are we using? N95. It's the filter, it filters out most of the pathogens. You always want to wash your hands, of course. Patient's door is always supposed to be closed. If you go in there to do a procedure or EKG, you have to keep the door shut. Measles, chickenpox, they're all airborne. They spread through the air. Has everybody got those? Airborne.
Mm-hmm.
Droplet. Are we all good with droplet precautions? What's the main one we think about?
Flu.
Flu. What's going on now? Regular face mask, hand washing. You don't want the patient to cough, sneeze on you. You know, it can 6 feet. I think that should be altered to 10 feet because you have a cough or droplet, it can travel farther than that. And contact precautions. Do we all understand contact versus airborne versus droplet? Contact would be what?
Mm-hmm.
MRSA?
Gown,
Okay.
gloves,
Right.
mask.
What are we watching for? MRSA, pink eye, C. diff, anything that if I touch it, I can get it, right?
Contact it.
Right. So what, you think about contact, what, do we need to wear a mask?
Yes.
We do. Why?
Unless you're touching your face.
We need a mask for contact. If person has MRSA in their foot wound and I'm coming to do an EKG, do I need to wear a mask?
No.
No.
Because MRSA is what? Contact precautions. Am I going to be touching that foot? Hopefully not. But you're still going to use your contact precautions. But am I going to be, breathing it in? No, it's not going to travel that way. That's why you kind of have to know the difference in those. You wouldn't wear an N95 mask to treat someone with MRSA. So everybody get the difference in those three and how we're going to treat them.
Yes.
Mm-hmm.
Okay. You always report injuries or exposure. If you've been exposed, if you didn't know the person had TB, you went in there the next day they were diagnosed, you would report that as an incident. So if I went in today and did an EKG and I didn't wear an N95 mask, and the next day I go back and there's cautions on the door because they've been diagnosed, that's an incident. You have to report that. You want to protect yourself too. Always follow these rules. You will see these again. Mark this. Put on any PPE outside the patient's room and remove it when? Before exiting. Do not use disposable equipment or share it between patients. I don't care what they're doing right now at your facility. If you get asked that on a test, we don't reuse it. Ever. Clean and disinfect equipment. So when you're done doing EKG, what do you have to do? Clean the wires, the clips, before and after. You're going to follow your policy. Never place patient equipment on contaminated surfaces. Be familiar with your available. Follow directions on the patient's door. All right, diaphoresis and cyanosis. Are y'all good with those two? Everybody
Sweating
knows?
and turning blue.
Right. And what does the turning blue indicate?
All right.
Low oxygen.
Mm-hmm. Right. Body temperature. Just know the difference. Can it be affected by age, illness, exercise? Yes. These are all pretty common, sense things. You guys know that. Temperature sites. Do y'all know these? Tympanic is what? The ear. Axillary is where?
Armpit.
Under the arm.
Under the arm. We will see that again because that axillary region is part of where you're going to put your electrodes. So just be familiar with that word. And temporal is where?
Right there.
Right.
Like your forehead.
Yep. So just know the difference. Know your equipment. Here, if we're going to take, this goes through all of how to take a temperature. The main things are what in doing anything. If I go in there, just take a temperature, what's the first thing I'm doing?
Wash your hands.
Identify myself.
Right. You're going to identify yourself. Yes, wash your hands. That's great. But if your choices are identify yourself or wash your hands, what are you doing first?
Identify yourself.
Right. Because when you walk in there, you have to say, I am so-and-so. I'm here to do your EKG, blah, blah, blah. Then you wash your hands. Wash your hands, yes. But if the choice of the two, you have to identify yourself. And you have to identify